New developments in an ongoing lawsuit which could change how donated livers are distributed throughout the country. Vanderbilt University Medical Center says it would lead to more Tennesseans dying while waiting for a transplant. News Channel 5's Blake Rosnowski is live to explain the policy change, what that means for patients in the mid-state. And Blake, every day and minute matters for these patients.
Adam, News Channel 5 has been following this story for almost a year since a federal judge temporarily halted the implementation of a policy that changed how donated livers were distributed, making it so they can go further away to the most critical patients. Now, that lifted just a few weeks ago, and now Vanderbilt University Medical Center is saying they're worried for what it will mean for their patients.
Robin Majors developed liver cancer 6 years ago. He was number 22 on the list for a transplant, expecting to wait for months.
You're anxious already, thinking, dang, this is the only thing that's going to keep me alive.
Then he got the phone call that saved his life.
And I made the list January 15th of 2014. 13 days later, I got the phone call. So pretty amazing that it all happened that fast.
Today, there's a good chance it would have taken much longer because of the recent liver distribution policy change. That's a big concern for Dr. Seth Karp, the director of the transplant center at VUMC.
Perhaps 2 or 3 times the number of patients that are dying on the waiting list will now die in Tennessee waiting on the waiting list instead of getting a liver transplant.
Dr. Karp says a lot of Tennesseans donate organs, roughly 3 times as many as a state like New York.
Before, it was basically the community was responsible for its own donation. So if Tennessee wanted to have more donors to do more transplant to save more lives of people in Tennessee, they would have to do better with donation. And if New York wanted to have more donors, then have more transplants, then they would need to get more donors.
He says the solution isn't to take from rural states with worse health care to benefit wealthier urban states, but instead to encourage more people to become organ donors.
If New York could get, and New York and other urban centers could get to the same donation levels that we have here in Tennessee, there would not be an organ shortage for livers, lungs, or hearts. That's an extraordinary statement.
And for the man whose life was saved because of an organ donor, Majors agrees.
Sign your donor card. The only way these doctors are going to help people are to get out there and sign your donor card, and I'd appreciate it if you do.
The nonprofit organization that runs the transplant system, the United Network for Organ Sharing, says this change will save more lives. We have a full statement from UNOS on newschannel5.com. A lawsuit against the way that policy was implemented is still ongoing. Live at Vanderbilt University Medical Center, Blake Rosnowski, News Channel 5.